Welcome to week 3 of Candidate Voices with 5051 Savannah, the series that brings you 5-minute interviews with candidates for Georgia's 1st Congressional District U.S. House election 2026. We welcome any candidates running for this office who meet our mission of upholding the Constitution and ending executive overreach to participate. Each of our candidates receive the same question in advance and are allowed to prepare. We're back with week 3 of Candidate Voices with Joey Palimeno. Welcome, Joey. Here's the question of the week. Rural parts of the 1st District face growing healthcare deserts, especially for mental health and maternal care. What federal policies would you support to improve rural healthcare access and prevent further hospital closures in this region?
Thank you for having me on. And yes, rural parts of Georgia's 1st Congressional District, places like Camden County, where I live, Ware County, Glynn County, and all across our coastal and inland communities aren't just facing healthcare deserts. We're watching families get crushed under a healthcare and economic system that's honestly just failing them, in my opinion. You've heard the stories, and I've lived them. Patients driving over an hour for a pediatric visit that parents can't afford to miss work for. Moms who have to deliver in emergency rooms because there's no local hospital to give birth at. Local people or people in crisis in waiting rooms for months waiting for mental health support or walking away without any help at all because they're afraid they might get stigmatized. It's not just alarming to me, it's kind of unacceptable. I look at stories like Amber Thurman's, it's a 28-year-old mom and medical assistant from Georgia who tragically died from septic shock after a medication abortion that the state's maternal mortality review committee found her death was preventable, and that delay of 20 hours of care before necessary emergency was a large, as they quote it, cause of that outcome, which is tied to our strict abortion ban that we have in place. And it gets worse when you look at the numbers. The United States has the highest maternal mortality rate of any high-income country. I believe in 2022, the U.S. saw just over 22 maternal deaths per 100,000 lives births. That's double, even triple the rate of most of our peer countries. Norway, for example, reported 0 in that year, while the comparable countries stay in the single digits. Even worse, Black moms face a horrifying rate of nearly 50 deaths per 100,000 live births, more than double that of white mothers. How do these other countries manage? I mean, the biggest difference is most have universal health care, robust midwife systems, and guaranteed postpartum support. We have none of that. We're the only high-income country without universal health care. Nearly 8 million women at reproductive age right now have no insurance at all. Georgia, like most states, did recently expand Medicaid for postpartum coverage for 12 years, but in my opinion, we can do a lot better than that. And I just want to be clear on why we don't have universal health care. It's not because people don't want it. It's because poll after poll shows we actually support it. The reason behind it is special interest groups, healthcare insurance companies, pharmaceutical giants, and hospital lobbying groups that pour millions of dollars into political campaigns, not mine, keep the system broken. They profit from our premiums, our co-pays, our medical debt, and they make sure Washington protects them and not you. Every year, these corporate donors spend more money on lobbying than almost any single industry, and they've been stopped. They've stopped universal health care for decades. Both parties should actually fight for it. On top of that, economic injustice is killing moms. Don't have stable housing, you're going to miss prenatal visits. If you earn poverty wages, you can't afford time off of work. Get there, to pay for gas to get to your appointment. And in rural parts of our district where public transportation is basically non-existent, like in mine, if a provider's even in town, then how do you get there? You gotta have a car, which of course requires money. These barriers tie directly into mental health struggles as well, too. Stress, anxiety, depression. They're not just medical issues, they're rooted in housing instability, financial instability, transportation barriers, and isolation. Yet our system treats mental health is still optional, underfunded, and it's still very stigmatized, in my opinion. I suffer from anxiety as well, and I'm open about it, and I seek treatment, and I'm doing very well. Poor mental health crisis doesn't just harm individuals, it harms our entire country's safety. When people can't get help, stress and despair can fuel desperation. This can contribute to things like higher crime rates, increase of mass shootings, which is the unique American problem, While mental illness alone isn't the cause of violence, lack of accessible care is definitely a critical factor. Definitely a critical factor in community safety, in my view. And the recent cuts to Planned Parenthood, Title X, family programs only make the situation worse. Title X is a federal program that provides crucial funding for family planning and reproductive health services for low-income people. When funding is cut or restricted, rural clinics are going to close. They're going to lose the ability to afford birth control to give up to people, cancer screenings, prenatal counseling, and even mental health support. For many women, these Title X funded clinics like Planned Parenthood are their only healthcare providers, and losing these services leaves mothers and babies vulnerable and communities weaker. We also have a critical shortage of healthcare providers in the first district. Doctors, nurses, and mental health professionals often leave for urban jobs with better pay and resources. To fix this, we need federal investment in loan forgiveness programs, uh, financial incentives to recruit and retain health workers to stay here at home. Because local residents know our community better. So we need to keep those doctors here. One
Thank
of the
you,
first steps.
Joey. I'm so sorry we've run out of time.
It's okay. It's okay. Healthcare is a complex topic. I could talk all day about healthcare. It really is.
Thank you for joining us this week. We'll see you next week.
Okay. Thank you very much. I appreciate it.